I'm so happy to see you again. Congratulations again on your new little one. It's so hard to believe he's already 6 weeks old. So, you had mentioned at your last visit that you would like to discuss birth control methods before returning to intercourse. You're 6 weeks postpartum now, so now's a good time to start talking about that. Do you know what birth control method that you would like to use? Oh, you want to hear what options are out there. Okay, great, we can do that. First, can you tell me if you plan to be sexually active? Yes? Okay. And then how about children? Do you plan to conceive again? Yes? Okay. So that would eliminate any permanent options then. Has there been any methods that have worked well or not well for you in the past? Okay, you had the copper IUD and had some heavy periods with that and used condoms which were effective but not your preferred method. Okay, that helps to know you're not interested in the copper IUD again and would like to try a hormonal method. Can you also tell me what is most important to you in regards to birth control? Are you looking for one that is best at preventing pregnancy, easiest to use, helps with heavy periods, helps prevent STDs? And are you preferring less or no hormone options? It kind of sounded like you were leaning towards the hormone option. Okay, I'm glad to hear your periods are better after stopping the copper IUD. And that's great that you're in a monogamous relationship and you're not concerned with STDs. I'm really glad you asked about hormonal birth control and breastfeeding. That's a great question. What are your plans for breastfeeding? You would like to breastfeed for at least a year. That's an awesome goal. That's great. And yes, there are lots of options that will support that. Let me show you a chart I like to use to compare all the methods that will really lay out your options, and then we can talk more about those breastfeeding friendly methods that will not hinder your milk supply. So let's just use this chart. So the first one on here is the implant. So that is a little rod, just a tiny little implant that is inserted in your arm, and it stays there for 3 years, and it is 99% effective. So on this chart, the least effective methods are down here, and then as we go up, they're more effective here. So, like I said, that one's 99% effective. A vasectomy, which is male sterilization, or a tubal occlusion or tubal ligation, or you may have heard the term tubes tied. That's sterilization of the woman, those are permanent. It sounds like that's not what you're looking for, but those are 99% effective. And then there's an IUD option. Those are the implants, the intrauterine implants that go up inside of your uterus, and they sit there and stay there. Those can last from 3 to 12 years. Those release hormones locally there that help prevent pregnancy. And those are 99% effective as well. Excuse me. So as we move down, there's an injectable option. So it's a shot that you would get every 3 months, and that is also a hormone option that prevents pregnancy, and that is 94% effective. Another option is hormonal birth control pills. There's combined hormonal birth control pills, and there's also single hormone pills, and that is 91% effective when taken appropriately every day around the same time, and that again is something you would have to take daily. There is a hormonal patch. It's just a transdermal patch that would go right on your arm. It's kind of like a sticker, and the hormones are delivered that way to prevent pregnancy. That is 91% effective, and you would be placing that weekly on your arm. There's other places in your body it can go to, but that's the most common place to put it, but whatever works for you. Then there's also the hormonal ring. This is 91% effective, and you would have to place that monthly. It goes up inside the vagina and releases hormones there to prevent pregnancy. Then as we move down here, there is the male condom. That's 85% effective when used correctly every time, and again, you'd have to use it every time. This does provide sexually transmitted infection protection, as does the internal or female condom, and that is 79% effective, the female condom. You have to use it correctly every time. And then there are also fertility awareness-based methods, and these are 76 to 80% effective when used daily. And these methods, if you've ever heard of natural family planning, it's basically tracking your monthly cycle, your period, your ovulation, all that good stuff to know when your most fertile times are. And then if you are fertile, then you know to abstain or not have sex or to use protection during that time. That's a non-hormonal option, obviously. And then there is a diaphragm, which is a silicone cup. You can insert it up to 18 hours before sex. And what that does is it has a spermicide. You can use it with a spermicide, and then also it blocks sperm from getting up through the cervix to meet the egg. Similar to that, that's 88% effective, and similarly to that, there's a cervical cap, which is very similar to a diaphragm, but it's a little bit smaller. It's like another little silicone cup kind of that goes up against the cervix. You would always use that with a spermicide, and that's 71 to 80% effective. Another thing that is similar to that it has a spermicide in it and also blocks sperm from going up to fertilize an egg, is a sponge, and that is 76 to 88% effective. You'd have to use it every time you have sex, and that does go up inside the vagina as well. And you could insert that up to 24 hours before you have sex. Another method is coitus interruptus, also known as the withdrawal method or pulling out. And that is only 78% effective, and you'd have to do it every time. And it can get kind of tricky because it doesn't always work, but and again, it's only 78% effective, so that's something to consider as well. We already talked about the female condom. And lastly, there's the spermicides on here. Those are 71% effective, and you'd have to use them every time, and that just kills the sperm so that it cannot get up to the egg, to fertilize the egg. And there's a couple other methods that are not listed on that chart that you may have heard of, and one of those is outer course and abstinence. So abstinence is completely refraining from intercourse, not having sex at all. It sounds like you're planning to continue having intercourse, so that obviously probably won't be an option for you. But another method is outer course, and it involves other sexual activities, but you don't have vaginal sex. So there's no sperm going to the vagina, can't fertilize an egg, obviously. And then there's another method that's not on the chart, also called lactation amenorrhea method, which some people use while exclusively breastfeeding, like you are. And when you exclusively breastfeed, which that means that you nurse your baby at least every 4 hours during the day and every 6 hours at night. And you're feeding your baby only breast milk. There's nothing else that your baby's getting. They're not also getting formula, and you're not pumping, you're actually breastfeeding them. When that happens, your body just naturally stops ovulating, which can prevent pregnancy. And about 2 out of 100 people who use breastfeeding as birth control get pregnant in the 6 months that method can be used after the baby's born. Oh yes, that's a great question. There is things such as emergency contraception, but it is just that. It is emergency contraception and should not be used as a regular form of birth control. It's kind of like a backup if something falls through. There are a few different kinds of emergency contraception, and what method you use, or which one you use, is based on a few factors. When you had sex, your weight, whether you're breastfeeding, and what kind is easiest for you to get, which one is accessible to you. These methods have to be used within 5 days of unprotected sex, and the sooner they are used, the more effective that they are. So to answer your question from earlier, with breastfeeding, the progestin-only options or the non-hormonal options, such as condoms or the natural family planning, are the preferred choice of contraception if you're breastfeeding. And so it kind of sounds like you were going to try a hormonal option this time. So progesterone-only contraceptives come in several different forms. So you have a couple options there that are still safe to protect your milk supply. One is the progesterone-only pill, and that's also sometimes called the mini pill. Another is the birth control injection or the shots that we talked about, such as Depo-Provera. Again, it's progesterone-only. And then there are progesterone-releasing IUDs, such as the Mirena or the Skyla, and that IUD is the intrauterine device that we talked about. And then there is a birth control implant, which is called Nexplanon. Excuse me. So that injection is a birth control shot. You'd have to get it every 3 months, like I said. This does have more progesterone than the implants do. The Depo-Provera or Depo shot is an example, if you've ever heard of that one. And if you were wanting to use an oral contraceptive, there is the mini pill or the progesterone only pill option. This pill contains progesterone only, so it's safe for breastfeeding mothers. And when this method is used daily, it's highly effective for breastfeeding women. This method is does have a slightly higher failure rate than oral contraceptives that have both the estrogen and the progesterone in it, because you have to take it at the same time every day, or you can quickly become fertile. So like within 3 hours time frame, like you have to be very meticulous about taking it at the same time, and you have to take it every single day, or you can become fertile like that. Then there's also the birth control implant or Nexplanon. It's a tiny thin rod. It's about the size of a matchstick, and it lies just beneath the skin of your arm. The implant releases hormones into your body that prevent you from getting pregnant, and again, that is just the progesterone only, so it's safe for breastfeeding. If you're wanting a long-term birth control that isn't permanent, you may want to consider one of the IUDs or the intrauterine devices. The two types to use while breastfeeding are the one that is copper that you had previously tried and didn't really like. And then there's another one that is that only has the hormone progesterone. The copper IUD has no hormones in it, too, so it won't affect your milk supply. And then those others have the low level of progesterone, which won't cause those problems with your milk supply. One benefit of the progesterone-releasing IUD is that it delivers its hormone directly into the lining of the uterus, which only leads to a slight increase in the progesterone levels in the bloodstream, which is much lower than those found with the progesterone-only pill. And so as a result, there's much less chance of side effects from the progesterone than from the injection or the mini pill. So you like the idea of the arm implant? Okay, so this would be a good option for you. It would help you meet the goals of maintaining your breastfeeding while still being able to prevent pregnancy. So I'll tell you a little more about that method. Like I said, this is a birth control implant. It's a tiny little thin rod about the size of this matchstick here, so it's very small. It's called Nexplanon. There's a slightly older version called Implanon that you may have heard that name before too. The difference is that the Nexplanon is actually radiopaque, so it will show up on imaging. And what we would do is we would insert the implant just superficially underneath the skin of your arm here. And we would do that after numbing your arm with lidocaine, of course. So it's a quick poke for the lidocaine, and then it usually doesn't cause too much discomfort after that. It can be a little sore after we put the implant in, the following day. It is a very quick process. And then, of course, it would need to be removed in 3 years and can be replaced at that time, or you can leave it out if you no longer want it. And if you didn't want it, it could come out sooner than that as well. It's removed by using the same lidocaine to numb the arm, and a very small incision is made, and then the implant is pulled out. It works by releasing the hormone progesterone to stop you from getting pregnant, and those hormones in the birth control implant prevent pregnancy in 2 ways. So the progesterone thickens the mucus on your cervix, and that stops the sperm from swimming up to the egg. And when the sperm can't meet up with the egg, pregnancy can't happen. The other way that it works is it stops the eggs from leaving your ovaries. This is also called ovulation, so when your egg's released every month. And so there's no egg for that sperm to fertilize. So when eggs aren't released, you can't get pregnant. Some of the awesome things about the implant is that it's low maintenance and it lasts for a long time, up to 3 years. But it's not permanent, which is nice. So if or when you decide that you do want to get pregnant again, or if you just don't want to have your implant anymore, you can have it taken out. You're able to get pregnant quickly after the implant if you decide you want to do that once it's removed. It also may help your periods be lighter. It will not interrupt intimacy, so it's not something that you have to do anything with right before you have intercourse. And you don't have to think about using it every day, so you don't have to worry about forgetting it. It's always going to be doing its job by itself, slowly releasing those hormones throughout time. And then, of course, another benefit is that it's safe for breastfeeding, which is what you're looking for. I know you said that you aren't concerned about STDs, but just a reminder that it does not prevent STDs. just so you have all the information, I also must mention that some people do get a few side effects that bother them after getting the implant, but these do usually go away after a few months. The most common side effect is usually irregular bleeding or spotting, especially in those first 6 to 12 months when your body's still getting used to it. Sometimes the implant causes long-term spotting or periods get longer and heavier, but really for most people, the implant makes their periods way lighter, and actually 1 in 3 people usually with the implant stop getting their periods at all after a year. And really, it's okay to not get a period when you're on Nexplanon. That is okay for your body not to do that. And if you miss a period, it doesn't necessarily mean you've become pregnant, because it is really a very effective method of birth control. And you could always take a pregnancy test if you want to be sure. And you can always palpate the implant in your arm for reassurance that it is in place, which is important to do so you know that it has stayed there where it's supposed to be and that it's working effectively. There are some other side effects. Other possible side effects are headaches. This is kind of a nice visual of some of the side effects that occur. Breast pain, nausea, sometimes weight gain, ovarian cysts can occur. Sometimes there's pain or bruising, like we said, about where the implant goes, where it's inserted. Sometimes it can be a little sore. And of course, rarely sometimes there's an infection where the implant was inserted. These side effects are not common though. Implants are usually free or low cost with most health insurance plans, with Medicaid and some other government programs, but we can always contact your insurance to figure out if this is going to be covered for you, so that way you know exactly what it will cost you. So if this is a method that you would like to try, we can order it for you and set up an appointment to have it inserted soon. You'll need to use a backup method such as condoms in the meantime until you come back for that appointment. You would like to use this method? Great. So based on your history and the information that you've given me, I think this would be a good method for you. We will see you back in about a week then, and we'll place the implant after we've gotten it from your insurance. We'll give them all the information that they need. We'll figure out how much it costs for you, check with you first, and then when we get that in, after a pregnancy test, we can put that in for you. And just so you know, Nexplanon does start working right away if it is placed within 5 days after the start of your period. However, if it ends up being placed at any other time during your cycle, or you're not sure when your cycle is, you'll just need to use another method of birth control like condoms for at least 7 days. So tell me, what other questions do you have?